And now you can move down to between C1 and C2 level to assess the range of movement at C1, C2 joints during flexion and extension of the upper cervical spine. You can also assess side flexion in a similar position. Again, you support the crown of the head in your abdomen. This time, you've got the thumb on the left hand, if you're doing left side flexion, anteriorly palpating the anterior inferior aspect of the mastoid process, and posteriorly supporting the occiput. Your hand on the right side has a thumb facing towards the left and the fingers facing towards the right to support the opposite side of the head and to bring about the side flexion movement. Remember, for the upper cervical spine, side flexion is a head-on-neck movement, like so. As you perform side flexion to the left, you should feel between the occiput and C1 a reduction in the joint space. This can also be repeated for C1, C2 levels. You can also assess rotation in this position of the occiput to C1 level. Similar handhold to before, your hand posteriorly around the occiput, your hand anteriorly on the anterior inferior aspect of the mastoid process, your thumb palpating this process, and your right hand, the fingers facing to the right and the thumb facing to the left, can help to impart the rotation movement with both your arms. As you rotate the patient's head to the left, you should feel a decrease in the joint space between the occiput and C1. In the presence of abnormality, such as hypo or hypermobility, this may be altered. It is best to perform the PIVM to assess cervical rotation at C1-2 level in the sitting position. In order to do this, I'm going to ask the patient to sit up again. You can swing your legs over the edge. I'm going to lower the bed. I'm going to ask the patient as well to move along the bed so they're near the end, and it makes it easier for me to palpate their cervical spine in this position. In this position, you use a pincer grip with your thumb and index finger to palpate the spinous process of C2. Your thumb and index finger are either side of the spinous process of C2. With your right hand, if you're doing a right cervical rotation, you have the right hand on top of the head with the fingers and thumb splayed out. You will impart the rotation movement passively with the right arm. The left fingers are palpating when the spinous process starts to move. You're using the right hand to rotate the head and C1 vertebra on C2. When all rotation has been taken up at the C1-2 level, you will feel the spinous process start to move. The spinous process on rotation of the cervical spine to the right will move to the left. You will also appreciate with your thumb that the lamina on the right side of C2 vertebra will push posteriorly when you have taken up the range of movement at the C1-2 level on rotation. You assess the range of movement on the other side, so going to left cervical rotation to assess for any asymmetry between the two sides. Prior to assessing joint range of movement, specifically in the cervical spine, you need to do a general assessment of the soft tissues and skin. You can generally assess the soft tissues and skin using the back of your hands, brushing down the back of the neck. What you may find is altered temperature and increased sweating. Temperature changes and excess sweating can indicate an autonomic dysfunction. You can also have increased temperature in the presence of inflammatory changes. However, do remember the patient may simply be anxious, and that's why you may be noticing excess sweating and increased temperature. You can then go on to palpate the soft tissues, asking the patient to report any areas that are tender or any symptom reproduction. Doing this prior to doing any specific joint mobilization assessment has the advantage of increasing the patient's confidence. I'm now going to assess the bony structures so that I can assess whether there are any bony abnormalities present. We're going to start off with the top of the cervical spine. In order to facilitate easy access to the upper cervical spine, I'm going to ask the patient to tuck their chin in. If you come down from the end of the occiput and direct your pressure upwards, you're directly pressing over C1 vertebra. However, in most subjects, it's not possible to directly palpate on C1 vertebra, so you're pressing over the soft tissues on top of the vertebra. You then come down to C2, which is the large bony prominence that you first hit below the occiput. The large spinous process of C2 often overhangs C3, making it difficult to palpate. C3 is just directly below C2, and then a few centimetres further, we've got the C4 spinous process. A few centimetres further, the C5 spinous process, then C6 spinous process, coming down to C7 and T1. C7 and T1 spinous processes form the bony prominence at the base of the cervical spine. If you want to confirm whether you have palpated the structures correctly, you can put one finger on C7 spinous process and one finger on C6 spinous process and ask the patient to extend their head and back down again. If your fingers are on the correct level, the C6 spinous process should disappear from underneath your index finger. You can also palpate the facet joints. First of all, find C2 spinous process and then move slightly laterally, maybe 2 centimetres, and slightly down. That will place you over the C2-3 facet joint. Similarly, if you want to palpate C3-4 facet joint, find C3 spinous process, go a couple of centimetres laterally and slightly down, and that will place you over the C3-4 facet joint. You can also palpate the lateral masses of C1 are a few centimetres from the midpoint of the skull. You can also palpate the first rib in this position as well. Patient is prone lying, and what you can do is lift up the trapezius so you can palpate directly on the rib, pushing in a caudad direction. And this places you directly over the first rib. So again, on the other side, lifting up the trapezius, soft tissue, this allows you direct access to the first rib. You can also palpate the bony structures on the front of the cervical spine. And I'm now going to ask the patient to turn over onto your back. And lift up your head. You need to assess the condition of the skin first by using the back of your hands to palpate for any temperature changes or any sweating. You can then specifically palpate the soft tissues, asking the patient to tell you if there's any tenderness present or if any pain is reproduced. Then moving on to the bony structures in the neck. You can palpate the various vertebral levels from the anterior aspect of the neck as well as the posterior aspect of the neck. Starting off with C1, You can palpate